Thank you, Megan. So hi, everyone. My name is Sharanya, and I'm a fourth-year PhD candidate in the program of Work and Health. My presentation will be focusing on health privacy during return to work management, and it will focus on the impact of the COVID pandemic on this process. So in health research, there are 4 types of privacies that are studied. And so the first is physical privacy, which deals with the ability to control the physical space around oneself. It's linked to the concepts of personal space and territoriality. And the next is social privacy, so the choice to disclose and when. Social privacy is used to manage social interactions and establishes different ways to interact with others. So for example, how much an injured worker would want to disclose to their supervisors or coworkers with regards to their health issue would be an example of social privacy. Psychological privacy involves risks or deals with the risks involved with disclosing. Psychological privacy is a person's ability to control the most sensitive part of their self. So this is their thoughts, feelings, cultural beliefs, or religious practices. For example, an employee might choose to disclose to a manager that they're feeling depressed, which is one of their innermost issues, but the manager suspects the employee is lying, even though there are no grounds for their suspicion, and expresses that suspicion to the employee. This would affect the psychological privacy of the employee. And this is because the manager is questioning one of the employee's innermost sensitive issues, which would make the worker feel a loss of control over the information they just revealed to the manager. And lastly, informational privacy deals with maintaining control over how, when, and to whom, and to what extent private health information is communicated. So for example, workers should be able to decide how much to talk about their private life and to whom to disclose that information to, and to what extent sensitive information about them should be documented and disseminated. Informational privacy is violated when an unauthorized person gains access to someone's private information. So privacy and confidentiality are extremely important concepts that go hand in hand. The protection of workers' private health information is something that the labor movement has always recognized to be important. Worker health privacy is protected through legislation and ethical codes of conduct. Specifically, healthcare providers are bound by the Hippocratic Oath to keep health information private. So an example would be the doctor-patient confidentiality, while others across Ontario, like employers, healthcare providers, and workers' compensation board employees, are bound by legislation and acts such as the Freedom of Information and Protection of Privacy Act, FIPA, Personal Health Information Protection Act, and the Workplace Safety and Insurance Act. And similar acts with varying titles have been implemented across other Canadian provinces as well. However, legislation is really the ethical minimum. So as a society, we also depend on ethical codes of conduct that are driven and enforced by our surrounding cultural norms, values, and beliefs. One of the biggest impact that the pandemic has had on our health privacy is through contact tracing measures. Due to the need for contact tracing during the pandemic, we're having to disclose our personal and health information more often and to more people compared to the amount of disclosure we had to do a year ago. We're having to provide temperature checks, disclose recent health symptoms like cough or fever, and provide information about where we're going and when through apps. We're having to disclose these types of health information when we go to restaurants, shopping centers, retail stores, when we're trying to access services, as well as at the workplace. So it's really perpetuated this culture of needing and wanting to know about other people's health information in the desire to be able to protect our own health. While these changes may have been a necessity to control the pandemic, they have really impacted the societal norms surrounding the way we view, manage, and maintain health privacy right now. Slide. So what is the impact to workers? One of the main challenges that employers are currently facing during the pandemic is knowing what information they can collect, when, and to whom they can share this information to. Employers can share can screen for COVID-19 symptoms. However, they cannot report a failed screening to anyone in a manner that identifies the employee. They can also put in place workplace policies that requires employees to self-disclose and remove themselves from the workplace when they're experiencing symptoms or have tested positive for the virus. Now, this is based on the Personal Health Information Protection Act, which states employers can collect and use personal information for purposes that are reasonable. It would also be considered reasonable for employers to collect some additional information from an employee after a positive test notification has been received. This is because the employer is obligated to protect all the other workers based on the Occupational Health and Safety Act from the infected worker. However, when you send the worker home, there will be speculation. Depending on the workplace culture and size, the health issue may not stay confidential. So while these checks and policies may be necessary, they impact and threaten the health privacy of workers if it's not conducted in a sensitive manner. Return to work management is the process used to manage work absenteeism due to injury or illness in our society. And in Ontario, the Workplace Safety and Insurance Act states that after a workplace injury, both the employers and injured workers must work together to achieve early and safe return to work. This policy requires that workers are returned as quickly as possible to suitable employment. And suitable employment is defined as work that is one, safe, available, and beneficial to the employer's business, two, within the worker's functional abilities, and lastly, when possible, restores the worker's pre-injury earnings. So during the return to work process, injured workers are encouraged or required even to disclose health information, which is part of the Workplace Safety Insurance Act. And often if workers don't disclose, then their claims may be rejected. When workers disclose their health situations, the existing body of scientific literature shows that there are positive return to work outcomes for the worker. And this is because the workplace parties' support and collaboration is a very crucial element for the successful return to work of the injured worker. However, disclosure comes with its own set of risks, and those include stigma and discrimination, which will vary based on the health condition or illness the worker has. Slide. So during the pandemic, the Canadian Society of Professionals in Disability Management carried out a survey of its members' experiences of managing cases. They found that return to work coordinators were reporting an increase in mental health conditions overall amongst the cases they were managing. Specific mental health conditions cited by the coordinators included stress, anxiety, depression, obsessive compulsive disorder, substance abuse, and post-traumatic stress disorder. Furthermore, mental health distress was a complicating factor in both physical injury cases and during workplace COVID outbreaks. Now, this is very problematic because both mental health conditions and COVID are highly stigmatized health conditions in our society. So these individuals are now being put in a position where they are having to disclose their health information, especially if they want to have a successful insurance claim or positive return to work outcomes, but they might not feel comfortable with doing so due to the stigma associated with it. So understanding how health privacy concessions are occurring and how the health privacy of injured workers is being maintained during the return to work process is even more relevant now during the pandemic than ever before. So my PhD thesis research will aim to understand the social, psychological, and informational health privacy during return to work management in Canada through the perspective of key stakeholders. And more specifically, I'll be conducting qualitative research to review the current literature on health privacy and return to work management, explore how return to work coordinators and key informants in Canada view, understand, and access private health information of injured workers, identify when and for whom health privacy concessions are beneficial during return to work management. And I'll also be exploring the influence of the return to work coordinator's work environment on access usage and usage of private health information. This is because return to work coordinators work in a variety of different settings like insurance and workers' compensation boards. And lastly, I'm going to be looking to explore and understand how the changing societal norms around informational health privacy during COVID-19 is impacting the work population overall. Thank you.